Hello, my name is Gabby Abrams,
And I'm Shannon Leonard.
and this is our presentation on cupping therapy. Cupping therapy is also known as Chinese cupping therapy, and it is an ancient form of alternative therapeutic medicine in which therapists put special cups on the skin in order to create a suction. There are two main types of cupping therapy, which are wet cupping and dry or fire cupping, but within each of these types of cupping, there are different techniques utilized. The intention of cupping is to create a vacuum so the blood is drawn to the surface of the skin in specific parts of the body which need healing. This type of therapy is often used in conjunction with other therapies such as acupuncture, acupressure, and massage therapy. Cupping is seen as controversial because there is always a risk of infection, as well as swelling, bruising, scarring, or even permanent damage to the surface arteries and veins. One very controversial type of cupping is wet cupping, which involves making incisions in the skin so that the patient bleeds during the therapy. This can lead to infections and prolonged healing time. Another type of controversial cupping therapy is fire cupping because it involves the use of alcohol to ignite a flame and heat up the cups. This can lead to very severe burns in extreme cases and prolonged healing time.
Cupping has perceived benefits, including that it helps reduce pain. A report showed that it helps reduce pain in people with lower back issues. It also is thought to boost skin health because it improves circulation and it appears to be effective for various diseases and conditions, including herpes and facial acne and facial paralysis. It is also thought to promote relaxation because it helps lift pressure in tense muscles, which offers a relieving sensation. It is also thought to improve digestion and help treat respiratory issues and colds. However, on the other side, the perceived negatives of cupping is that areas where the cup touches the skin, a patient may experience the following side effects, including mild discomfort, bruises, burns, and skin infection. Most dangers arise from wet cupping and fire cupping.
Our position on the practice of cupping therapy is that traditional cupping does not have a lot of scientific backing, but it is not inherently problematic and may be a recommended alternative type of therapy in certain cases. We believe that other types of cupping, such as wet cupping and specific techniques used in fire cupping, are not recommended and should not be used. Cupping therapy goes back many, many years and has been popular in China since around 1000 BC. Some records actually show variations of cupping being used as far back as 3000 BC. The exact origin of cupping therapy is unknown, but it has been practiced by many different cultures in all parts of the world. Historical accounts point to the possibility of migrating people carrying the practice with them. Ancient healers used the materials which were available to them at the time, such as animal horns and animal bones, seashells, ceramic, and bamboo. While there is not a lot of scientific backing for the practice and effects of cupping, what is known is that it works by expanding the capillaries and increasing the amount of fluid entering and leaving tissues. A 2011 report published in Evidence-Based Complementary and Alternative Medicine reviewed dozens of randomized clinical trials with patients in pain from any origin. This report found that cupping significantly reduced pain in people with low back issues as compared to their usual care treatments. This report also found that cupping helped soothe pain associated with respiratory issues and showed positive effects in treating cancer pain compared with anti-cancer drugs. Traditional cupping therapy has been used and recommended in Western cultures as an alternative to modern medicine. Alternative practices such as cupping don't pose the same unwanted side effects that have been associated with pharmaceutical medications and surgery. A 2014 article from the Journal of Traditional Chinese Medical Sciences reviewed 16 studies with 921 people. Out of the individuals with pain related to both acute and chronic diseases, results showed significant benefit of cupping compared with conventional drugs and their usual care. Many strides have been made in traditional cupping therapy, which have made it become safer over the years. The equipment used is now carefully sterilized under high pressure and high temperatures. We no longer use the primitive tools, which were initially designed for cupping, but instead use silicone, rubber, and/or glass cups. The materials today generally allow the therapist to watch the effect on the skin while performing the therapy, which has been proven to decrease the long-term side effects. Local anesthesia is also available to patients to lower their discomfort during the procedure. Modern medicine actually recommends that patients use cupping as a supplemental therapy rather than a primary therapy, in addition to more conventional forms of treatment. A 2014 article from the Journal of Traditional Chinese Medical Sciences reviewed 16 studies with 921 people. All participants experienced pain from acute or chronic diseases. This review found that cupping combined with acupuncture was superior to acupuncture alone on post-treatment pain intensity.
Even though cupping has been modernized in recent years, the different types, including wet cupping, are still very controversial. Wet cupping involves cupping suction, which is alternated by performing tiny cuts on the skin to allow the release of toxic blood and fluids from the body. However, infections are common enough that antiseptic medication has started being applied after the therapy. A 2010 review from the official journal of the International Society for Complementary Medicine Research looked at 550 clinical studies, the majority of which use wet cupping. This review concluded that the majority of studies showed potential benefit from wet cupping, but further rigorously designed trials and relevant conditions are warranted to support their use. Another type of controversial cupping is fire cupping, which is done by either igniting an alcohol-soaked cotton ball with fire, then holding it in the cup, which is called flash fire cupping, or putting a small amount of alcohol in a cup and then adding the fire, which is called alcohol fire cupping. Since the fire is only used to heat the cups, it poses less risk than wet cupping. However, it is best to seek out a trained and licensed therapist to reduce risk of potential side effects and damage to the skin.
In conclusion, we feel that cupping could be a placebo due to the very, very limited scientific evidence on its usage and success rates. However, there is enough evidence, mostly from testimonial sources, to support its continued usage, especially as supplemental treatment or as an alternative to traditional medicines. Other kinds of cupping, such as wet cupping and fire cupping, we view as potentially dangerous and we would not recommend their usage. Thank you very much.